Hello and welcome. Hearing your doctor say something like twisted bowel can sound pretty scary, but our goal here is to break down exactly what that means. We're going to talk about a condition called a volvulus, and by the end, I promise you'll have a much clearer picture of what's going on and what to expect. So, let's dive in. So, first things first, let's tackle the question you're probably asking yourself right now. What exactly is a twisted bowel? What does that actually mean for your body? Okay, the easiest way to wrap your head around a volvulus, think about a garden hose. You know when you get a kink in it and the water just stops? Bam, it's kind of like that. The twist creates a total roadblock in your bowel. Now all the gas and fluid gets trapped and the pressure starts to build up. And here's the really dangerous part. That twist can literally choke off the blood supply. When that happens, the tissue can get seriously damaged. That's why this is something that needs to be treated and fast. Now, it turns out that not all twists are the same. Where that twist happens in your colon is absolutely critical because it changes the entire game plan for treatment. So let's meet the two main players you need to know about. First up, we have the sigmoid volvulus. This is the more common one, making up about 60% of cases. It happens way down in the S-shaped part of your colon. Typically, we see this more in older men. Then you've got the cecal volvulus. This one's a twist right where the small intestine joins up with the large intestine. It's a bit less common, and interestingly, tends to happen more often in younger patients, particularly women.
All right, so how would you even know if you have one of these? And if you go to the hospital, what are they going to do to figure it out? Let's walk through what that whole process looks like.
Well, the symptoms of a volvulus are pretty hard to miss. The biggest one is usually major swelling in your abdomen, what doctors call distension. You'll likely feel a lot of pain and maybe nausea and vomiting. But the real telltale sign? Because of that blockage, you probably can't pass any gas or have a bowel movement at all. Everything's just at a standstill.
So to diagnose it, doctors need to get a look inside. And on a simple x-ray, there's a classic clue they look for called the coffee bean sign. It sounds a little funny, but it's because the trapped loop of bowel fills with air and swells up into a shape that looks, well, just like a giant coffee bean. It's a dead giveaway that points them in the right direction. For the sigmoid type, there's another famous sign. If doctors use a special dye to light up the colon on an x-ray, they'll see the dye travel all the way to the twist and then just stop. It tapers off into a sharp point that looks exactly like a bird's beak. It's another one of those visual clues that pretty much screams, the problem is right here.
But here's the thing. While those X-ray signs are super helpful, the definitive test these days is a CT scan. It is the gold standard. Why? Because it's almost 100% accurate. It doesn't just confirm there's a volvulus, it shows doctors exactly where it is and, most importantly, if the blood supply is in trouble. That information is crucial for deciding what to do next.
Okay, let's talk about fixing this. We'll start with the more common type, the sigmoid volvulus. For this one, the first step is often something that doesn't even involve surgery. It's all about getting immediate relief. The procedure is called an endoscopic detorsion. Basically, the doctor uses a thin, flexible scope, kind of like what's used for a colonoscopy, and guides it right to the twisted spot. With some careful maneuvering, they can actually untwist the bowel. And the second it's untwisted, whoosh, all that trapped gas and fluid comes rushing out. The relief for the patient is almost instant. Sometimes they'll even leave a small, soft tube in there for a bit, just to help it stay untwisted.
But, and this is a big but, there's a catch. Yeah, the scope provides amazing, immediate relief, but it's not usually a permanent solution. See, the reason the bowel was able to twist in the first place, that problem is still there. And get this, the chance of it happening again is somewhere between 45 and 70%. That's a huge risk. So you can see why just untwisting it isn't the end of the story.
Exactly. Because that risk of it happening again is so high, the standard recommendation is to schedule a surgery after the patient is feeling better. This isn't an emergency operation, it's a planned procedure to go in and remove that extra floppy part of the colon that's causing all the trouble. The goal is to fix the root problem for good.
Okay, let's switch gears and talk about the other type, the cecal volvulus. And it's so important to understand that the approach here is completely different, and it's a whole lot more urgent.
This right here is the number one thing to know about a cecal volvulus. It's a surgical emergency. Unlike the sigmoid type, trying to untwist it with a scope just doesn't really work. So there's no time to waste. The standard of care is to get the patient to the operating room right away to get it fixed.
The surgery they'll do is called a right hemicolectomy. All that means is the surgeon removes that whole twisted section of the bowel. Then they simply reconnect the healthy ends. It's a definitive solution that removes the problem area so it can never, ever twist again.
Wow, we have covered a lot of ground, haven't we? From the symptoms to the scans to the treatments for both types. So let's just boil it all down to the key things you and your family really need to remember as you move forward. Let's recap. Point 1. A volvulus is definitely serious, but it is very, very treatable. Point 2. The two types, sigmoid and cecal, are like night and day when it comes to treatment. Remember, sigmoid usually gets a scope first, then planned surgery later. Cecal, on the other hand, means surgery right away. And finally, the most important first step for either one is getting that quick and accurate diagnosis from a CT scan.
The best thing you can do is be your own advocate. So what questions should you ask? It's simple. Start with, which type of volvulus do I have? That single question cuts right to the chase. And then your follow-up is, what is the next step in my treatment plan? Asking these two questions will empower you and make sure you're on the same page as your doctors every step of the way.